Hey everybody, I'm Sandy Middleton, Executive Director for the Center for Violence Prevention. And as we close out Human Trafficking Awareness Month, I wanted to take just a minute to interact with some of our human trafficking rapid response advocates that are working daily throughout the state to assist victims. So I just wanted to spend a few minutes with them and let you guys hear from them as far as what they're seeing and experiencing out across the state. So we'll jump right in. Let me start out with Amanda. So Amanda covers North Mississippi, and let me just kind of throw it out to you and ask you, what are you seeing as far as the cases and ages, and have the numbers increased, and just give us a glimpse of what you're seeing in North Mississippi.
Well, there's definitely an increase in the victims that I'm seeing in North Mississippi that are minor victims, which are victims under the age of 18. Probably more 14-year-olds in the past year than I've had previously seen. I think what we're finding out is the age that these children are being introduced to trafficking is like 12 to 14 in North Mississippi. A lot of familial trafficking, which means that they're being trafficked by family members. We have a lot of children that are frequent runaways, that are children that are in CPS custody, and they might be in foster homes or group homes. There's a lot of frequent runaways there. Of course, we've seen a lot of children that were lured in through some kind of social media. That's been pretty common, but can definitely say over the last year, looking back from 2019 numbers to the 2020 numbers, for me personally in North Mississippi, I responded to at least double the cases for these minor victims.
Okay, that's a pretty shocking number when you think about our children, and but it's a good thing at the same time that we're starting to screen them in and recognize them and be able to identify them as victims. So I think it's of course, it's a terrible situation, but I'm glad that our state is making some steps in the right direction to take care of our children. Nikki, so Nikki works on the Gulf Coast, and Nikki, what is the hardest part of your job?
I believe that we all have our different experiences with difficulties in the field, but I think for me personally, it is getting attached to, the clients that we serve and wanting the best for them. And so, getting very connected and trying to find that balance to continue to do your work professionally while still caring and showing compassion in the field for who we're working with.
So self-care is really important because you have to get up in the middle of the night and respond whenever you're called. Mm-hmm. You don't get the luxury of an 8 to 5 job. So, and I know sometimes that's difficult, having to roll out at 1 and 2 o'clock in the morning and having to respond on holidays and weekends. And I know that's one of the hardest things about your jobs, and that you are on call a lot and you're very much in demand, and you never know when that phone's going to ring. And so that certainly increases the level of stress in your job. So just a quick follow-up, how do you manage, how do you take care of yourself?
Yes, so, it's definitely a position that requires a lot of that flexibility that you mentioned, being willing to serve as best as you can, unexpectedly whenever you're not expecting to, whether it's a weekend or a holiday like you mentioned. I guess just trying to find ways to balance everything out, work with a good team. Having a good team atmosphere also helps a lot with that, because you can rely on another coworker in your territory to work with you and get them connected to resources. I don't know, I find that that's helped me a lot in this job. So.
Yeah, and it's kind of funny because I know y'all have a group text.
Yes, we do.
I think Christina and I have gotten in on that group text and multiple times, and you guys really are a lot of support for each other out in the field any time of the night and day, and that's a pretty important thing to as far as self-care is concerned. So Casey works down in the Pine Belt, and Casey is an attorney. So I just wanted to ask you how your background as an attorney informs the work for you.
Absolutely. A lot of our clients that are adults in particular have some kind of legal troubles that they're going through. And so understanding how that process works helps us as we advocate for them, whether you're meeting with law enforcement to discuss, potential charges, what might be going on. And, or if you're meeting with the prosecutor or the defense attorney, and just, to show that this person is a victim, and that a lot of times the charges are related to them being victimized by their trafficker, that they may have been forced to, commit a robbery of some sort, or they may be self-medicating with drugs so that they don't, they aren't as cognizant of that trauma that they're living through all day, every day. And so sometimes through being exploited, they end up caught up in the judicial system. And that's one more obstacle that they have to overcome before they can start, being empowered to regain their life and to make their own decisions on what they want their life to look like. So I think as an attorney, it helps me understand kind of how that process is working, what they're going through, what point of the process they're at, but then also how I can better advocate for them by knowing who I need to talk to, and what the consequences are of different decisions. And early intervention obviously is the best for trying to get them perhaps placed in a program or something, instead of seeing them be victimized again by having some kind of sentence for maybe a crime they were forced to commit, rather than getting help in a shelter or in a rehab.
Okay, it's a great answer. So all of you guys, and I didn't introduce, of course, everybody knows Christina McCool. She's our operations manager for our human trafficking efforts, and that includes both our tower, which is our long-term program, as well as the rapid response effort across the state. So Christina's got a big job, and then we're glad to have our Central Mississippi rep down on the end too. So just kind of throwing this out to all of y'all, what barriers do you see on a daily basis?
I would say definitely lack of placement resources for the victims, especially with the minor victims. There are no specialized services in the state of Mississippi. There's no specialized facilities. And victims of human trafficking, survivors of human trafficking, they have very specialized needs, and it takes a long time to kind of overcome the things that they have been through. So we don't, we do our best to reach out. We've got a list of resources, but none that are specialized for their needs in our state. Oftentimes we have to look outside our own state to be able to provide for those needs.
Okay, anybody else want to jump in on that one? As far as barriers on a daily basis?
I think that's a pretty big one. I know there's a lot of people in the state that work very hard for the children, but I definitely want to second that as well, having just more placement for the kids.
Specific, specialized, long-term opportunities for healing, and yes, I certainly agree with that. How can we do a better job moving forward as a state? I mean, with all of the time and all of the education, and you guys have all had extensive training from national experts. I mean, we've attended multiple national trainings and sat around the table with some of the best people in the country when it comes to the training and the decisions that are made for our services and our programming, and what we do, we know it works. I mean, we've got evidence-based programming, and we've worked real hard to evaluate our program and make sure that what we're doing does work. So just when you kind of back off and look at the state as a whole, what, in y'all's opinion, what could we do better? What do we need to do better? Of course, we've already mentioned the children. What else?
I think the education is vital, because a lot of people don't know about us, and just spreading the word, about what we do and what we can offer. And I think it's extremely important to change the mentality of the way people look at victims and judge victims based on what they think they know. And all of that is education to me.
Yeah, awareness, and how many times have we seen children who have had terrible criminal actions perpetrated against them, then turn around and go to jail,
Right.
or go to detention for something that has happened to them, for them to literally bear the sins of an adult
Right.
for something that they perpetrated against them. And it's true also for adults. I mean, we talk a lot about our minors, but we've got a lot of adult women that we're working with they're in jail right now, and we're engaged with them and trying to help them while they're serving their sentences. So, that's definitely important. Christine, you want to add anything to that?
I think we need to address the vulnerabilities that lead to trafficking. So whether it is, addiction in the home that leads to the exploitation of the children in the home, or it's our kids that are already in the foster care system that we're not doing a great job addressing, their historical trauma, so that they, when they start expressing the symptoms of that trauma, they don't get labeled and then further shut down the system and, just further and further away from what it is that they need. But the vulnerabilities that are exploited, both in our youth and then in our adults. So you got the financial vulnerabilities, the lack of a GED, and then you have trauma that's compounded that prevents them from being able to obtain their GED and going to college and being reintroduced, as someone who can earn a sustainable living. So all of those things are areas that we can, as a state, improve altogether.
Yeah, and something just as simple as when we're considering our workforce development training, I mean, do we really need that GED component? And how important it would be for the clients that we work with if they could just step right into a program for workforce training without having to go through the whole process of the GED. I always joke about, I'd hate to take the math part of the GED myself. I mean, it's very intimidating for people who either didn't do well in school or were suffering trauma while they were in school. So, the GED is a mighty big hurdle for a lot of the clients that we serve. So, one of the most important things that we do is through our partnership with law enforcement and prosecutors across the state. And several years ago, you guys got out in the field and recruited workers and investigators who wanted to serve and who wanted to investigate these cases, and we were able to sign some MOUs and start some task forces across the state. So I want to ask Christina to kind of talk a minute about the importance of those task forces, and then I'll let y'all kind of chime in after she talks to kind of say your feeling about why it's so important to you.
I think the task forces initially brought everybody to the table, and so we could learn from one another. We have shared experiences. It definitely is a resource multiplier. So investigators have a huge job when they're talking about investigating trafficking-related crimes, and but you have the human part of the trafficking-related crime that they don't have the time and capacity to really address the needs of that victim in a meaningful way. And so we come alongside and we carry that burden and we meet the needs of that victim and survivor. And I think that's the biggest thing is the collaboration, the relationships that are built in the task forces amongst law enforcement of the federal, state, and local level. And then with the victim service providers, at the table as well, because it's a critical component. So many law enforcement investigators have said, we can't do this job without victim services. And so we've really been able to develop unbelievable relationships across the state so that they can do their job better and that the victims can actually receive meaningful services.
Okay, great. And there are a lot of really close relationships with the teams across the state. And, when you're out together, trying to take care of somebody that's been so traumatized, and then, of course, law enforcement's geared up to go find the bad guy. And, there's a lot of passion involved in the work, and there's just a lot of commitment and dedication to getting this job done and putting these people behind bars and helping victims. So what do y'all want to add about the task forces yourself?
Well, I think what Christina was saying, the relationships, what you were saying, the relationships have been key for collaboration, but also, you know, we've been able to bring a lot more focus on these cases and bring training in. There was a lack of training, I know, in our area of North Mississippi. You know, obviously law enforcement was skilled in knowing that there was human trafficking, but maybe they didn't have some of these tools, you know, through their federal partners, state partners, and then victim services as well. So the education kind of gave them a deeper level of understanding of the victims, of who they could reach out to, collaboration. And I think it just kind of solidified a lot of things that we were trying to move toward, to be able to provide an overall approach to fighting human trafficking, whereas on the law enforcement side and also the victim services side.
Okay. Anybody else?
I think one of the advantages is sometimes people, when you mentioned human trafficking, maybe it was not apparent on the surface that that was the crime being committed. Maybe people saw domestic violence or sexual assault, different crimes. And so bringing the group together and really being able to focus on what is human trafficking, how do we identify it, and, you know, what options are available to the victims helped bring an awareness to it. And I know a lot of the officers that I worked with, immediately once they started looking at it that way, could identify people that they had encounters with in the past, you know, maybe for different misdemeanors or different things like that, that they knew were involved in that life, and they didn't realize that they were victims. And then once they started paying attention, they started seeing who behind the scenes was actually controlling that person. And then we were able to come in as victim services and offer a solution. And I think so many times prior to that, law enforcement doesn't have time to look up all the resources. They may not know what all is available. And, you know, maybe the option was kind of, well, you know, this person's hanging around people who are committing crimes. Maybe they're involved, maybe they're going to get arrested. And now there's other solutions at the table where you can say, you know, no, this person isn't going to live a life as this repeat offender. Instead, they're going to get help and they're going to reclaim their life that was stolen from them. And I think that's so powerful. And you can just see, I mean, you already mentioned people being passionate about that, but you could see that passion grow from, you know, maybe an abstract concept of we've heard of human trafficking to I know of this woman and I'm going to help her. And, you know, and we're going to, you know, wherever she is, we're going to find her and we're going to offer her help. And I think that was just, you know, truly one of the amazing parts about being a member of the task force, everybody coming together with that same goal.
Okay. So we're going to wrap. Thank you for spending some time with us, and I hope that hearing from some of our rapid responders across the state will raise awareness and help people to know what's really going on out there. So thank you for your support and have a great day.